Hello, my name's Dr. Jane Wilkinson, and I'm the Associate Dean for Education in the Faculty of Medicine, University of Southampton, and a respiratory consultant at Southampton General Hospital. I studied medicine at Southampton University as an arts graduate with no science background at all. In the last 30 years, I've experienced many ups and downs as a doctor, but I've never for a single second regretted my decision to pursue a career in medicine. You are considering a career in medicine in the middle of one of the worst health crises the world has had to face for many years. The National Health Service is at the forefront of the country's mind, and never have healthcare workers been held in such high regard. Our final year students were able to graduate earlier than planned this year to join the NHS workforce to support the fight against COVID-19, and never has the faculty felt so proud of its students. We're also delighted that you are considering a career in medicine in such challenging times, particularly as you've already had to cope with major disruption to your education in the last few months. We know that your academic success may not be judged in the conventional way, but there are many equally, if not more important attributes required of a future doctor. I'm going to talk a little bit today about why I think choosing a career in medicine is a really great idea, why I think you should consider studying medicine at Southampton. I'm going to give you a brief overview of our medicine programmes, and I'm going to talk a little bit about our entry criteria and selection processes. So why do I think it's a great idea to choose a career in medicine? Well, now we're in no doubt what a rewarding and worthwhile career it is, and in these times that's never been more evident. There's a huge range of opportunities available to you once you qualify. There are many different personality types that come into medicine, and there's a niche for everyone. And you will be presented with stimulating and varied opportunities throughout your career. During a career in medicine, you never stand still. I think it's also worth pointing out, particularly in this age of huge economic uncertainty, where many people in the population are facing redundancy and economic hardship, that medicine offers excellent job security. We've all enjoyed the weekly clap for carers and the high approval ratings for doctors at the moment, but we are also blessed because we've been able to go to work and able to continue earning a living, and that's been an enormous privilege. With those privileges does come some rather more negative aspects of becoming a doctor. You work long and antisocial hours and may continue to do that for your entire working lives. Although we're basking in public approval at the moment, there are times when things go wrong and you face public scrutiny and sometimes criticism. There's no doubt that this can cause great stress and anxiety. You're dealing with people's lives at the most vulnerable time. And we need to enable you to develop the coping strategies to deal with this stress and to manage it effectively. So what do I think the qualities are required of somebody to become not just a good doctor, but an excellent doctor? Some of these are self-evident, but I want to draw attention to one or two. You must have a genuine interest in people, i.e. you must be curious, or in other words, you need to be a nosy Parker. You need to be genuinely interested in what makes people tick, why they respond to their illness in the way that they do, why they present in the way they present. You need to be able to get into their shoes and walk around in them. Now more than ever, you need to be able to cope with uncertainty, not just on your own behalf, but on behalf of your patients too. Doctors are decision makers, but with that comes a need to take responsibility for your own actions. And that begins from the moment you enter medical school. You need to be a really great communicator, both with your colleagues and with your patients. If you want a little bit of light bedtime reading, then I highly recommend these two publications, both of which can be downloaded from the GMC website. These are the Outcomes for Graduates 2018 and Medical Students' Professional Values and Fitness to Practice, which gives a great more detail about what skills you need to become a doctor. So why should you choose to study medicine at Southampton? Well, when I came here, it offered me a place despite the fact that I had a single biology O-level. It allowed me to study science for a year before embarking on the 5-year programme. So it welcomed me on the basis of other attributes other than my total lack of science qualifications. And I've never stopped being thankful for that opportunity. Southampton remains an innovative medical school with an up-to-date curriculum. We constantly revise and update our curriculum to reflect the needs of 21st century medicine. Our curriculum is systems-based, i.e. you study the body systems in turn, integrated with clinical cases, and spiral, which means that you revisit topics throughout the curriculum, building on your knowledge as you go. A key feature of our programmes has always been early patient contact. You're studying to be doctors, and therefore you need to meet patients from the very beginning. When you arrive at medical school, we encourage you to behave as future professionals, and professionalism is embedded throughout our entire curriculum. We expect high standards of behaviour from you, just as we expect high standards of behaviour from qualified doctors. We've introduced some breadth into our curriculum by having student-selected modules throughout the programme, in Year 1, Year 3 and final year. These include modules looking at humanities and include languages in the Year 3 SSU. We're a research-embedded university, and we're very proud of our research track record, particularly in the current COVID-19 crisis, where we've been at the forefront of trials in therapeutics, vaccines and personal protective equipment. But we also have a fantastic track record in research in cancer, for example, with our Cancer Research UK building, and asthma and allergy are other examples. I've mentioned already that medicine carries with it some stress, and so it's beholden upon us to offer you excellent pastoral support throughout our programmes, and we have a fabulous senior tutor team who do this. All students also have a personal academic tutor who remains with them for the duration of their course. I'm going to talk a little bit about the individual medicine programmes that we offer at Southampton. These include the 4-year graduate entry programme, BM4, the 5-year BM5 programme, which is predominantly for school leavers, but also we have some places for mature non-graduates and some graduates. We have a 6-year widening participation programme, our BM6 programme, and we have a 5-year bilingual programme, our BMEU programme for German students. I've mentioned already that our curriculum for the BM5 programme is systems-based, integrated and spiral, with its early patient contact and student-selected units. In Year 2, all students will complete a healthcare support worker placement. This is to ensure that students understand the way hospitals work from a different perspective to that of a medical student. All students in the BM5 programme will complete the research project, which entitles them to a BMed-Sci honours degree at the end of Year 3, in conjunction with the BMBS award that they will get at the end of the programme. Between Years 3 and Year 4, students have the option of pursuing an intercalated year, either doing a Master's in Southampton or an external Master's or Bachelor of Science elsewhere. Our clinical modules in the final years of the programme are based on an apprenticeship-style model. We are always focused on the fact that we're training you to be doctors. Our curriculum is outlined here in a scheme where you can see the systems-based modules in Years 1 and 2, alongside longitudinal modules in Medicine in Practice, and in Year 2, a Research into Medicine and Health module, which allows you to develop some basic research methods, critical appraisal knowledge, and to do some preparation for your project in Year 3. After the project module in Year 3, you're in clinical placements until finals in January of final year. After you've been liberated from the burden of finals, you have the option to pursue an elective period of study, which can be either in the UK or abroad, and you will complete an assistantship module, which is a specific apprenticeship style module to allow you to hit the ground running when you enter into your foundation programme as a newly qualified doctor. The structure of the first 2 years in the BM4 course is different. There you learn in context around clinical topics in years 1 and 2, with much clinical experience during those first 2 years based on the Winchester campus. You will be in graduate groups as a focus for your learning, but for your final 2 years of that programme, you will join with your BM5 colleagues and graduate together. This is an outline of the BM4 curriculum where the last 2 years are identical to the BM5 programme, but the first 2 years, as you can see, are structured differently. Our BM6 programme is our widening participation programme. There are specific eligibility criteria to enter onto this programme, which are all available on our website. These students have a year 0 before joining with their BM5 colleagues in year 1 of the BM5 programme. Year 0 is conducted over 3 days a week in small group setting with extensive tutorial and pastoral support, and also including some observational healthcare placements. There is a bursary available for these students in their first year. On successful completion of this year, they pass into the 5-year programme and join their BM5 colleagues and graduate with them at the end of final year. Once you're into the clinical part of your programme, you will move across the Wessex region for your hospital placements and GP placements. This gives you the advantage of being with fewer students in centres where you can maximise your clinical opportunities. Our centres are distributed all over Wessex, as far north as Wexham, as far east as Chichester, west as Dorchester, and placements include the Isle of Wight and Jersey. And our students have a fabulous time all over the region. This is a map of our biggest placement provider, the University Hospital of Southampton. And this is where much of your teaching takes place throughout the programme, including the early years. Southampton is a local district general hospital which serves the needs of our local population, but it's also a regional and tertiary referral centre for things such as neurosciences, major trauma, cancer medicine, and so on. We're truly blessed at Southampton by having a fantastic medical student society, MedSoc. Students arrange a variety of social, charity and outreach events which you can participate in. They're very active in sport and working with the local community, and they provide excellent student welfare facilities too. We pride ourselves in Southampton as a faculty in having an excellent relationship with our students. For our entry criteria, please look at our website or feel free to ask questions at our Q&A session. You can find information about the university's clinical aptitude test at the following website. Once we've invited you to interview, we're much more interested in the non-academic criteria. We want you to demonstrate that you're self-motivated and resilient, that you've reflected on and learnt from your life experiences, including work experience, both in and outside health and social care settings. We want to show that you're an effective communicator, that you can interact well with others, and that you understand the values of your future workplace, the National Health Service. In essence, we want to see the qualities that make us confident that you will make an excellent doctor. You apply through UCAS, and the deadline for applications is the 15th of October 2021. I want to finish this talk by just highlighting some of the student feedback that we received when our General Medical Council visit happened in 2018. The GMC visits us to quality assure our programmes, and they arranged to meet with students to seek their views. Huge numbers of students turned up, and we had no control over the views they expressed, so we were somewhat anxious about what they might say. But we were delighted by their comments. The students universally recommend Southampton Medical School as a friendly and effective educational experience. Students are exposed to a diverse range of patient types. Students are engaged at all levels within the medical school, and the school is prepared to listen and adjust their processes to improve the student experience. I think these are really great comments, and there are more which you can read for yourselves. I'm truly proud to be leading the programmes at Southampton Medical School, and I really look forward to welcoming some of you to interview and hopefully welcoming you onto the course thereafter. I wish you all the very best with your studies and look forward to meeting you in person one day.